If CMHA didn't exist, where would you be right now?
I would be dead.
I started very badly in life, unfortunately. At the age of 3, I experienced abuse. There was sexual abuse and physical abuse.
Well, I have been struggling with PTSD since I was 19 years old, and I'm 53 now. I was in the armed forces, not Canadian, but in my native country, which is Bulgaria.
So I went to my doctor originally because I was having issues with my anxiety and my bipolar. And I was finding that it was affecting my day-to-day life and really causing me to be in a place where I was getting more depressed and more withdrawn.
My PTSD, I have a lot of guilt inside me. And I lost friends in the army. And there was that nagging question in the back of my mind, why I didn't go and all of them go. We were all 19.
I was a very messed up individual. I didn't know how to get my life straightened out. And it wasn't until I hit about 40 and I went, my life's going nowhere, and then I did something that put me into prison.
And he had kind of let me know about the CMHA, the Canadian Mental Health Association, and that they had different programs that might be able to help me. So he helped me fill out a referral form and send it to CMHA, and they contacted me shortly after to start the short-term counseling.
One of the first things they did at Bounce Back when they were facilitating was she asked, how is my space? What am I feeling right now? And do I have a safety plan if anything is going to happen or go wrong?
The improvement was amazing for 6 months. First, Dr. Gottlieb adjusted my medicine. After that, Christine do her magic with my PTSD. And like I have to say, the improvement, I would say 80% improvement for my PTSD. A, because Dr. Gottlieb adjusted my medication and give me something additional, and B, because Christina did her job very well. I don't have the flashbacks anymore. I still think about it, but I think about it not as a traumatic event for me. It's more like, I accepted that to be part of my life.
What CMHA has helped me to do is kind of go in the center of those two halves of myself and find the good attributes of both and use the strengths from both of those sides to kind of live my life successfully.
It was great to do the Bounce Back because that shows the commitment to what I want to do, which is get myself better. And I'll use any and every material available to me to get myself back to what I consider a normal situation, a normal feeling in life.
CMHA is almost a philosophy. It's if you look at our longer term vision of mental health for all, CMHA is about reaching that goal. It's how do we provide better supports for people in need? How do we provide better access? How do we improve our services constantly? How do we improve public awareness? How do we help people understand that mental health is not something different, it's part of health? How do we advocate with the government to give equity of services across the province and show that mental health services actually reduce things like unemployment and use of the court system, and that if they invest heavily in this part, we can make society better and do it at a cost that's less than we currently spend on all mental health challenges across the system.
Life is not a walk in the park. There is gonna be some days are always better than others.
The Bounce Back actually gave me the focus to start fixing me because I knew I was broken.